everyone. This is the Safety Committee's regular safety and health webinar that we're presenting. These have been very successful, and we're very glad that all of you are in attendance. So you know that this will be recorded and put on Facebook. So if you weren't able to attend the whole part of this or you want to share this, they can go to Facebook. By tomorrow, it'll be all set up there. But today we're lucky to have Tom Veeser. Tom is an RN and Master of Science. He's the Chief Nursing Officer and VP of Quality at Holy Family Memorial, Freighter. Tom's been in healthcare for over 35 years, spent the last 20 years as a Chief Nursing Officer and VP of Quality in Wisconsin. Last 2 years, he's been the CNO and VP of Quality at Holy Family. His expertise includes healthcare operations, population health, nursing, and quality. Tom's key points today will be talking about vaccinations and its role at HFM. Go ahead, Tom.
So hello, everybody. Again, I thank you for having me here today and be able to share some of the information that we have regarding the vaccinations. I'm titling this the nuts and bolts of vaccination for our community members. And I'll take you through the journey of when we receive them, how we get them, how we distribute them, and how we schedule for them. And at the end, I'm happy to take any questions that you may have regarding the vaccine or the various types. So as Randy indicated, I'm the Chief Nursing Officer at Holy Family Memorial in affiliation with Freighter Health and Medical College of Wisconsin. And first off, I'm very excited that I feel like we're seeing the light at the end of the tunnel regarding this pandemic. It's been a long year of not knowing what this virus is, learning how to somewhat treat the virus, how to stop the spread, and now getting the vaccinations is quite exciting for especially us in healthcare. So Holy Family received its first shipment of COVID-19 vaccine in December. It was the Veeser brand, and it's a very important first step in closing this pandemic. So to date at Holy Family, we've administered 3,630 first doses and over 2,000 second doses of the COVID-19 for a total of 6,000 shots in arms. Wisconsin, in comparison, has administered 1 million people with 700,000 having received their second doses. And currently, our highest priority has been healthcare workers and people 65 and over. And Wisconsin's got about 50% of those over 50 that are vaccinated, and in Manitowoc County, we're staying pretty much at the same level. So we're in the upper quartile as far as counties in keeping up with getting the vaccinations, as we put it, in arms. We have had both the Pfizer and the Moderna vaccines, and we are expecting we'll probably receive Johnson & Johnson as it was just approved. There will be 47,000 doses of Johnson & Johnson coming to Wisconsin this week. All of the vaccines work fairly similarly on how they teach our antibodies to fight a virus with a protein spike on it. And then that teaches us how to that helps us stop getting the infection. And we follow all of our COVID-19 vaccine very, very close. So how do we get the vaccine? We have our own vaccination task force, and we participate in the Northeastern Wisconsin Healthcare Coalition for COVID activities. And the FDA approved the, excuse me, I've just said that the vaccines are shipped to our regional hubs in the state. And we are part of the Northeast Wisconsin hub. So there's a hub and spoke type of approach in Wisconsin. And as we have to submit our requests for vaccines each week, and based on availability and shipment, that's how many we learn. And then we open up our registration online. Recently, in the last few weeks, we've been delayed on shipments because of the ice storms that impacted much of the country. but we seem to be getting back into our normal distribution and looking like we'll be increasing here in the next week. So who's getting the vaccine now? Up until now, the frontline health workers, residents of nursing homes, EMS have been the highest risk, and those who have been administered vaccine first per the DHS, or Department of Health Human Services. And then a month ago, we opened up to the 65 and over. And now, effective March 1st, we're opening up to teachers and a select group of frontline workers that were not in the first round. With the new opening for teachers and the increase in J&J, DHS has indicated there will be about 700,000 new people that will be eligible for vaccine, and we will be getting an additional 90,000 doses a week. So doing the math on that, it's going to take us about 8 weeks to get through this next wave of people eligible for the vaccine. Whenever we do the vaccinations, we follow the CDC guidelines and the state guidelines, and they're pretty prescriptive as to how we have to move forward. Individual counties in the state have been designated as recipients of the COVID-19 vaccinations for teachers. So the health departments will be determination of putting the schedule together for each of the school districts. So for Holy Family, we'll be working with the Manitowoc Public Health Department to roll out the vaccine to along with Aurora, Manitowoc County Health Departments, and the Medicine Shop Pharmacy with the various school districts. We expect our first shipment to arrive probably next week or mid-month for the teachers. As the teachers are now eligible to register for vaccine at the provider of their choice before then. As more vaccine becomes available, the CDC will expand vaccination to other groups. I heard this morning on the news that they're anticipating the general public to be eligible by May to June as we get through the people most at risk. Again, the COVID-19 vaccination is not mandatory, but is highly recommended for adults. So when can the general public get the vaccine? As I indicated, it's looking like May and June. We will make public announcements here at Holy Family about the vaccine availability. And at the same time, the government is announcing the availability. We will be in sync. Once the vaccination is available to the public, registration to receive it is done at our website, which is www.hfmhealth.org. And we ask that you do not register yourself or a loved one ahead of the eligibility. We have to fill out forms, and it's very frustrating if we have to turn people away on the day of the vaccination and then open it up to the eligible. And then we also ask that you be patient with the process, although I have received nothing but compliments on how our process has been going with the registration and moving people through. We have not had many lines at all, but each week we get a growing number of people between first dose and second dose. And now as the teachers are coming in and we're getting more supply, it is getting busier. So we ask for people to be patient with us as we manage this process. The next category is, what do you need to know about the COVID-19 vaccine? The Pfizer and Moderna, which were the first FDA approved for emergency use, are both spaced between 21 or 28 days apart. And you need both doses received to get the full effect. And it's about 10 to 14 days after the second dose that you're considered fully immunized from the vaccine. When you schedule your first dose, you should also schedule your second dose to ensure that you receive it. And you should always receive the second dose at the same place you received your first dose. Different healthcare systems may have different vaccines. Again, it's dependent on the hub as to what they will send us based on availability. With Johnson & Johnson receiving its FDA approval this week, we will anticipate getting some of that throughout the spoke vaccination centers this week. The thing that's different about Johnson & Johnson is that it only needs to be refrigerated. In a regular refrigerator, it can be stored for 3 months, and it's one dose. So it is a good vaccine for certain populations that are less mobile or have a difficult time coming back for a second dose. When you receive the vaccine, to ensure that there's no complications, we ask that you be monitored for 15 minutes to ensure you don't have an allergic reaction. We've had well over 1,000 of our frontline people and EMS and firefighters vaccinated. We've had minimal side effects. The biggest side effects that we have are a sore arm and tired, more so after the second shot, but it's been going fairly well from all of the people that we've administered in that first round. The COVID-19 vaccinations are approved by the Catholic Church. And the Pfizer and Moderna are 95 and 94% effective against preventing COVID-19. And Johnson & Johnson is 84% effective. All of the vaccinations are 100% effective at preventing death, which is the most exciting. So some people have had a mild illness, but it's very effective at preventing serious illness and death with the vaccination. Vaccinations are recommended for anyone who is in a high risk category related to the illness, and the American College of Gynecologists also recommended for pregnant women, nursing women, and childbearing age. The vaccinations are free from the government. The funding is the cost. The government is funding the cost of the vaccine. You will be asked at Holy Family for your insurance card because you are billed for the administrative fee. If your insurance doesn't cover the administrative fee, or if you pay privately, we will not bill anyone for the vaccine injection fee. The next level of questions that we receive frequently is, once I'm vaccinated and immune, do I still need to wear a mask? As we still have the illness in the community, and we still have a significant population without the vaccine, it is still recommended by the CDC and by Holy Family to wear your mask. It's going to take us several months to get everyone vaccinated. And until that time, it's important that we continue to take the same precautions that we have been taking so far, which have been very, very effective. The mask is probably the most effective thing that you can do to prevent the spread and our spreading to others for the COVID-19, and then practice social distancing of 6 feet away from others. And then the other elements are good hand hygiene. Don't gather in large groups, especially if they're not vaccinated. Stay home if you're sick. Clean and disinfect your surfaces such as doorknobs, and avoid touching your eyes, nose, and mouth. And don't skip your doctor's appointments. One of the biggest issues we've had with this pandemic is people having worsening illness, especially chronic care, by avoiding doctor visits because of fear of getting the COVID-19. So that gives you a very good overview of what's happening in the vaccine world, and I'm happy to take any questions. There's a question there. What is the effect of the vaccine on heart health? There is no information that indicates any concern with the vaccination on heart health that we have been made aware of at any of our readings and our incident commands regionally. Do we have a number to call to set up an appointment? At this time, we do not. We're doing online appointments only. The rationale being, we want our resources geared towards people getting the vaccination. When we get to a core number of people who have been vaccinated for the 65 and over, we will open up phone numbers for those. In the meantime, we ask people to support those who are not as comfortable signing up. And then we have been reaching out to some of our more vulnerable over 65 and scheduling them personally. You're welcome. Any other questions? Well, if there are no other questions, I'll turn it over to Shannon. This webinar was originally scheduled for February, which is Heart Month. And I believe Shannon is going to show a Women's Health Heart video.
Hi, I'm Jenna Domino, a nurse practitioner in the Heart and Vascular Center at Holy Family Memorial. I want to take some time today to discuss heart health, specifically women's heart health. We all have women in our lives, whether they are our moms, daughters, aunts, sisters, or grandmas. You might ask, why should women care? That is an excellent question, and I would like to share with you some important statistics on women's heart health. Heart disease is the leading cause of death in women, causing 1 in 3 deaths each year. That is 1 woman every minute. 2/3 or 64% of women who die suddenly of a coronary artery event have had no prior symptoms. 90% of women have at least one risk factor for heart disease. While 1 in 31 women die of breast cancer each year, 1 in 3 dies from heart disease. I know most of you are good about getting your mammogram every year, but how good are you at ensuring you are taking the right steps to a healthy heart? Risk factors for heart disease that can be managed are blood pressure, cholesterol, tobacco use, being overweight or obese, lack of regular exercise or activity, and diabetes. We women sure know a lot of numbers by heart, whether they are passwords, PIN numbers, telephone numbers, or birthdays. But do you know the most important numbers of your heart health? I challenge all women to make an appointment with their primary care provider and learn your personal health numbers. Those numbers include your blood pressure, your cholesterol, your body mass index, and your blood sugar. Work to improve those numbers, and if you need help, rest assured I'm here to help you reach a healthy heart. These numbers need to be rechecked at least once a year, which is why it's important to schedule an appointment with your primary care provider annually, even in your 20s and 30s. Next, I want to share with you the symptoms of a heart attack and how those symptoms differ in women from men. Typical heart attack symptoms include chest pain or pressure, back pain, nausea, vomiting, indigestion, shortness of breath, or extreme fatigue. While some women have no symptoms at all, the women that do often describe their chest pain as sharp or burning, and they more frequently describe pain in their jaw, throat, neck, abdomen, or back. If you think you or a loved one is having a heart attack, the most important thing that you can do is call 911. Calling 911 can ensure life-saving measures in the fastest possible way. EMS staff can also revive someone's heart that has stopped. Holy Family Memorial has the only 24/7 cardiac cath lab in Manitowoc and Sheboygan counties. To learn more about our cardiovascular services here at HFM, please visit hfmhealth.org/heart-care or call 920-320-3000 to schedule an appointment today.